Do you feel like when you squat, your knees tend to cave in or collapse? Well, this is a common problem with the squat, and it's called knee valgus. And it's usually due to a number of different things. So let's talk about that. So there's three common causes of knee valgus during the squat. Cause number one is an overpronated foot. And if the foot is pronated because it's a structural problem, there really isn't much you can do about it. And to be honest, if you have a pronated foot and you're squatting with shoes that address some of that pronation, it will naturally take care of some of that knee valgus for you. The next common cause of knee valgus during a squat is poor motor control. So actually you might have great foot mechanics, great hip mechanics, but as you get into that position, your knees they're just not used to squatting. So you may need to do more squats in order to start controlling for it. And you need to think about, don't let my knees cave in as I squat. Sometimes even doing this in front of a mirror will help with that. And then the third and final reason that you could have knee valgus during your squat is if you have hip weakness. Weakness in your hip will automatically cause your knee to want to move inwards towards the opposite knee. The reason for this is we have key muscles in the hip, like our glute medius, glute minimus, and these are prime stabilizers of the hip. So it's important when we're addressing knee valgus that we're looking below the joint, above the joint, and what's happening with control over the entire leg. So the first exercise is going to address some of the hip strength and the motor control. So it's kind of double dips in both categories. So the way this one works is as you're going to squat, you're going to put a band around your knees and you're going to use that to cue you to push your knees out. That cue of abduction of your hips and pushing your knees out with that little bit of rotation is going to help engage the hip muscles, but it's also going to keep your knees from caving in. So in addressing the motor control component and the hip component, you're killing two birds with one stone. So here's what it looks like. You're going to start in your regular squat position, cue the band out, so almost like you're rotating your knees outwards. You're driving the outside of your heels towards the floor, and then you're going to squat down and back up. Hold that tension, don't let it go in between repetitions, and back into it. If you're doing this correctly, you should feel lots of muscles working here. You may even feel slightly unsteady at the level of your foot. That's all completely normal, but you're trying to maintain that tension throughout the duration of the movement. You want high repetitions of this, so like sets of 5 will not get it done. You need 3 sets of like 15 to 20 repetitions, and you need to be doing this consistently in order to see results. The next move that we're going to do to help address the motor control component of knee valgus during a squat is a single leg squat. The way that we're going to do this is we're going to sit on a target and we're going to start pretty high up, and then we're going to try to keep our knee in line with our toes as we go to stand up, or we're going to try and kick that knee a little bit outside of our toes to prevent that knee valgus. We're going to build strength in this position, and then over time we're going to slowly lower the surface down to build more strength and increase that motor control. So here's what it looks like. So this surface has me just above parallel. Foot is planted on the floor. You're going to have the other foot straight, and then you're going to come up just like that. Nice and slow, control the descent back down, back up, and back down. You're going to feel wobbly during this movement. It's completely normal, but the goal is to not let that knee kick in. The more it kicks in, you're putting more stress on some of the other structures. In some cases, it's okay to train that for super high-level athletes that are in those positions, but for the everyday and average athlete, you're best to try and train yourself out of that position, especially if you're in a weightlifting type sport.